Hello, my name is Caleb Smith and I'm with the Rocket Miner with your regular COVID-19 or coronavirus update on this Monday, April 6, 2020. Looking at the global impact of this virus, Johns Hopkins University is reporting that more than 1.3 million people have been confirmed infected, and the global death toll is now more than 74,000 people. Focusing in a little bit tighter on the United States, the American death total has climbed past 10,000, with around 350,000 people confirmed infected. Now the good news is that the spread of the virus seems to be leveling off in some places, such as New York, which echoes recent trends that we've started to see in Italy and Spain, which is fantastic news. It's still growing in other places, which is why we continue to press the same common sense advice that you're hearing a lot. Maintaining physical or social distancing. If you're now out in public, it's recommended that you are out there with a mask on or head wrap of some sort. Trying to limit your touching of the T-zone, that space around your eyes, nose, mouth. In addition to just trying to only go out when absolutely necessary to stop the spread, to flatten the curve of infection so that we can all get back to normal a little bit earlier. Turning to Wyoming, as of the time of this filming, the number of confirmed coronavirus cases in Wyoming is 212. Breaking down those numbers as provided by the Wyoming Department of Health, that's 4 in Albany County, 9 in Campbell County, 4 in Carbon and Converse counties, 1 in Crook County, 38 in Fremont County, 3 in Goshen County, 8 in Johnson County, 45 in Laramie County, which is right now has the highest concentration, 4 in Lincoln County, 26 in Natrona County, 1 in Park County, 12 in Sheridan County, 1 in Sublette County, 5 in Sweetwater County, which today means it's been unchanged, 40 in Teton County, 3 in Uinta County, and 4 in Washakie County. Now both county and state officials note that these numbers are probably low. Right now the State Department has greatly limited the criteria for testing, which means not everybody's being tested through the state lab. Now our local officials stress that there are still testing possibilities available. In fact, a number of the local cases that have been confirmed came from people who were tested through private labs that didn't necessarily fit the official state guidelines, and had they not been tested, we wouldn't be aware of these cases and had been able to practice social contacting to see, and tracking to see who they were in contact with. And there are right now a number of people who are in self-quarantine pending the passage of time and or test results. Of that 212, there are at least 50 to 52 people who have recovered. It does depend on what your source is for the numbers. I'm hopeful that we'll be continuing to see a great majority of these people recover as swiftly as possible. The Wyoming Department of Health notes that at least 11%, or about 11% of the cases required a hospitalization. Now, those same numbers show that in about 23% of cases, they weren't sure if the people who were positive also were hospitalized. But even taking the most gross extreme numbers, adding that 11% to 23, that still means in a large majority of cases that most people do not need hospitalization. They're able to weather the cases at home. That is what is being done in Sweetwater County when it comes to most of our local cases. The first case has already recovered and gone back to work. The other cases which have been reported are reporting to be in good condition with only mild symptoms that are treatable from home. That's the case in the 2nd, 3rd, 4th, and 5th confirmed positive patients in Sweetwater County. As the impact grows, the fallout continues. State legislators anticipate that there might be multiple special sessions in the near future. The House Speaker, Steve Harshman, said, quote, "What is becoming clearer each day is the need for a special session, or even potentially multiple special sessions this interim, to address the health and economic impacts on Wyoming wrought by this virus and the collapse of the energy commodity markets," the Casper Republican said. The Legislature's Management Council, which is the leadership group that sets the agenda for the different committees, will meet on April 16th to assign specific topics, including, of course, the coronavirus, its economic impact, and the appropriation of emergency funds from the federal government. It's anticipated that after conducting studies in May, the committees will consider draft legislation to call for a possible special session in the late May or early June. In other news, the annual statewide football showcase, the Shrine Bowl, is canceled this year. It's noted that organizers are doing so because of the health concerns and because organizers did not want to put a burden on groups that have traditionally sponsored the game. Turning to Frank Selby, the Shrine Bowl's executive director. In addition to potential risks that linger as game time nears, we cannot in good conscience ask for financial support from communities as they are left reeling in economic efforts associated to the outbreak. We have some good news to report from Sweetwater County. The Sweetwater County Public Health Director, Kim Lineberger, announced today that local health officials received a shipment of viral transport media. That's the material necessary to ship samples of COVID-19 for lab testing. The Public Health Department also expects to receive another shipment of the viral transport media this next week. Also, as preparations are made, and we hope that we don't actually have to follow through, but just to be prepared just in case, Memorial Hospital of Sweetwater County has reported that it is exploring the use of local hotel or hotels for temporary housing for their employees, should that become necessary to protect healthcare workers. And other good news, we have the launch of the COVID-19 Response Fund. It's being overseen by the Memorial Hospital Foundation. Local healthcare officials wish to express their thankfulness for the generosity shown by the community. They are thankful for all the individuals, the businesses, the corporations that are giving, whether it's donations of personal protective equipment or PPEs, homemade masks, homemade gowns, or other thoughtful gifts. Sweetwater Memorial CEO Irene Richardson said, quote, "The outpouring of support has been truly amazing," she said. "We are so thankful for each and every donation the hospital has received and very honored to serve such a kind and compassionate community." It's note that the donations will go to directly support preparation and equipment needs, and these include, but aren't limited to, ensuring the staff has the necessary tools to provide patient care for COVID-19 positive patients, the purchase of personal protective equipment as needed, and the purchase of essential equipment as identified by the MHSC Incident Command Team. Also, if you wish to make a financial contribution, donations are tax deductible. Please go to MHSCF or Foundation Arts. Let me restart that. I apologize. The MHSCFoundation.com, or by mailing a check to the Memorial Hospital Foundation at 1200 College Drive, Rock Springs, Wyoming, 82901. They are also accepting mask and gown donations. There is a specific drop-off point near the front doors at 1200 College Drive, so all you have to do is just drive up to the front, hop out, drop off, hop back in, and leave them on their way. For those of you who don't sew, or you might be like me, who I can do a running stitch, but would prefer to leave it to those with much more skill and finesse. You can always donate materials, which can be placed at the same drop-off. For those who do have said skill, patterns and instructions are available at sweetwatermemorial.com. Also, when it comes to food, the hospital notes that they can only accept home-baked goodies if they are individually wrapped or individually packaged. If you're donating meals from restaurants, they must be in pre-wrapped individual servings, such as individually wrapped sandwiches, boxed individual pizzas, and or bagged individual takeout materials. And of course, if you want something straightforward, store-bought prepackaged treats such as chips, breakfast bars, granola, and other snacks are always welcome. To arrange a donation, contact Jana Gale at 307-352-8418. It's good that we have people who are willing to give and are trying to do so in the ways that best match their talents or best match their circumstances. There are those who are giving financially. There are those who, like I said, they are master sewsmiths, and many people are going to benefit from their fine stitches. There are those who are donating with their ears or with their time or by listening to other people, being encouraging, sharing tips. There are those who are contributing by staying at home, stretching out the pantry supplies just a little bit longer. Deciding that let's try to go one more day with what we have and who we have here. And you might be surprised if you do that one day and then maybe you'll be able to do it together. You might be surprised by how far you go. And you'll never specifically know what your impact was. But you should hold your head high, having known that you've done your part to get the community through what doesn't have to be as hard a time if we all do our part. That we can keep those numbers as low as we can. This has been Caleb Smith with the Rocket Miner newspaper, encouraging you to give how you can and to keep your eye out there on solid sources of news, be it the Rocket Miner, be it the Memorial Hospital Foundation's page, be it Memorial Hospital's page, and the other hardworking people out there who are doing their best to get solid, dependable, actionable news to you in this time when information saves lives, as does self-sacrifice. Have a good day and a safe tomorrow.